Sometimes the biggest threat isn't some invader from the outside. Sometimes the real danger comes from our own body's chaotic response. Today, we're going to unpack sepsis, a huge medical emergency that can start with something as simple as a common infection and then just spiral into a full-blown civil war inside the body. And to really understand how, we're going to follow the story of one patient whose journey tells us everything we need to know. So let's meet Ollie. His story starts with a diagnosis of pneumonia in both of his lungs. Now, on the surface, that sounds pretty straightforward, right? It's caused by a common bacteria. But as you're about to see, his body's reaction to it was anything but straightforward.
So let's just get on the same page. What is pneumonia? Well, it's an infection where bacteria or a virus gets into those tiny little air sacs in your lungs, the alveoli, and they start to fill up with fluid. It makes it really hard to breathe. But the fight, well, it should be contained right there inside the lungs. But then you look at Ollie's vital signs and whoa, his breathing rate was 60 times a minute. Now, to put that in perspective, a healthy kid who's just resting is closer to 20. This is incredibly fast. His heart was just racing at 152 beats per minute. And here's the weird part. His temperature was low, not high like you'd expect with an infection. Even with extra oxygen, his O2 sats were only at 90%. These are not just signs of a lung infection. These are full-body distress signals. And that leads us to the central mystery here. How on earth did a contained battle inside the lungs escalate into a body-wide, life-threatening crisis? The answer is a condition that's notoriously tricky to spot and even harder to treat: sepsis. So let's dive into our first section and talk about sepsis. The key thing to understand is that it's not the infection itself that's the biggest threat. It's the body's absolutely catastrophic overreaction to it. The defense mechanism literally becomes its own worst enemy. And here's the official definition for you. Sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to infection. That word, dysregulated, that is everything. It means the immune system's response isn't controlled or helpful anymore. It's just chaotic and destructive. Now, this slide, I think, just nails it. Think of pneumonia as fighting off an invader. It's a localized battle, right? Sepsis, on the other hand, that's a civil war. The body's own systems are now turning on each other, causing massive damage far, far away from where the infection even started. And this shows you exactly how that civil war unfolds. It's a chain reaction. First, the infection breaks out of the lungs and gets into the bloodstream. That triggers what's called a cytokine storm. Think of it like a massive, uncontrolled chemical fire alarm that goes off everywhere in the body. This storm damages the lining of the blood vessels, making them leaky. So as fluid leaks out, the vessels dilate and blood pressure just tanks. At the same time, tiny little blood clots start forming, clogging up the works. And here's the bottom line. Your vital organs start getting starved of the blood and oxygen they need to survive. Okay, so let's move on. Now that we understand that internal chaos, we can connect it directly back to those really alarming vital signs we saw in Ollie. First up, that crazy fast breathing. A respiratory rate of 60, that is a massive red flag. So why was it happening? Well, there are a few really critical things going on. Because his cells are being starved of oxygen, they're producing lactic acid, which is making his blood acidic. The body's quickest way to fix that is to breathe super fast to blow off carbon dioxide. At the same time, you've got this thing called a VQ mismatch, which basically just means the air coming into the lungs and the blood flowing through them aren't lining up correctly, so oxygen can't get where it needs to go. All right, so what about that racing heart? A pulse of 152, that's the heart working in absolute overdrive. What's that all about? This is pure desperation. With those leaky, dilated blood vessels, his blood pressure is dropping fast. So to keep blood moving to his vital organs, the heart has no choice but to beat faster and harder. It's the body's fight or flight system going into overdrive, trying to outrun a total circulatory collapse. And remember how we mentioned Ollie's cold hands and feet? That wasn't just some minor symptom. It's actually a classic and very serious sign of something called cold shock. It's a survival mechanism. The body is making a ruthless calculation here. It's saying, okay, sacrifice the periphery to save the core. So it clamps down on the blood vessels in the arms and legs to redirect every single last drop of oxygenated blood to the most important organs, the heart and the brain. And this is where we get to the most dangerous stage of sepsis. When all these desperate measures aren't enough anymore, we see a domino effect. Vital organs start to fail. This is septic shock.
Ollie's lab results tell this story perfectly. High creatinine means his kidneys are failing because they're starved of blood. Now, the low white blood cell count is interesting. You'd think it would be high in an infection, right? But a very low number is a really bad sign. It suggests the infection is so overwhelming, the body has literally used up all its immune cells. It's running out of soldiers. The high CRP confirms massive inflammation. And then there's that last number, lactate.
A lactate level of 2.6. This is a critical warning light. This one number gives us the clearest possible picture of what's happening at the cellular level. That number tells us one thing, loud and clear. His cells are suffocating. They can't get enough oxygen to make energy the normal way. So they've switched to this emergency backup plan called anaerobic metabolism. And the waste product from that process? Lactic acid. A high lactate level is proof that tissues all over his body are starved for oxygen. And that brings us to the definition of septic shock. This is the most severe point. This is when the circulatory and cellular collapse is so bad that even pumping the patient full of IV fluids can't get their blood pressure back up. This is the absolute edge of a cliff. But Ollie's story isn't just about cells and circulation and lab values. To really, truly understand what happened here, we have to zoom out. We have to look at the world his illness actually came from. This quote just frames this whole next section perfectly. Equity isn't about treating everyone the same. It's about recognizing that people start from different places and giving them what they need to have a fair shot at a good, healthy outcome. So let's connect this back to Ollie. He's a Māori child and his family lives in a cold, poorly heated home. That environment, it directly increases the risk of getting sick with things like pneumonia. And what's more, his family's hesitation to ask questions or push for answers isn't just them. It reflects a long history where many people have felt unheard or disempowered by the healthcare system. These are what we call the social determinants of health, and they are every bit as critical as his lab values. Which leaves us with this final, really challenging question. It's not enough to master the science of treating septic shock if we just ignore the societal factors that make people vulnerable to it in the first place. So how do we treat not just the patient in the bed, but also the world that brought them there?